We're so spoiled. It's just a given that we have this and that we have to have this to be successful. When we're writing a paper to submit, we've got to have an updated literature review, really know exactly. So we use it all the time in our work. If we want to strengthen the capacity for research in these places, they've got to be able to have access to, up-to-date literature.
Our Malawi program is now realizing its 20th anniversary. About 10 years ago, we built facilities in Malawi, constructed facilities, and one of the priorities was to have a seamless relationship with the library, have them train a librarian for the country. Essentially, that's the health science library in the city of Lilongwe. The capital is the UNC Health Science Library UNC project, and so having our librarians go over there, helping us to understand the equipment necessary to have a virtual library and connect to UNC, help us with the satellite infrastructure necessary to be successful, and to upgrade constantly. All of that was part and parcel. So that's a very specific example, but that makes our Malawi program 10 times stronger than it would be without that.
And I'm the director of the UNC project in Lilongwe, Malawi, and have been associated with it since its inception about 20 years ago. The library had such a important role in the development of that. We raised the funds to build a building on a Ministry of Health campus at Kamuzu Central Hospital, and part of that design was to have a small library. And the purpose of that library was to serve the clinical faculty, the research faculty, and all the students that came that were both from UNC as well as students that we trained from Malawi. Many of the training grants that we have been successful, both at the NIH and at the big foundations, a lot of it was predicated on the fact that students could get the information that they need in the field and do the research that they needed. And without that component, I can't say for sure that those grants would have been successful. So in terms of training, that would have really hampered our efforts. In terms of the standard research and the clinical care, certainly it would not have been at the level that it is now. People depend on that library to be there.
When then people visit us and they see the pictures and know about the Malawi library from any other resource-constrained country, their first question is, how can we do the same thing?